As a wilderness medical instructor who's treated hundreds of hypothermia patients, I'm going to share what emergency medicine teaches us about cold-related injuries and why the most effective treatment is prevention using simple, available technology. Hypothermia kills through a predictable cascade of physiological failures, and understanding this cascade explains why emergency sleeping bags are so effective at preventing progression from mild exposure to life-threatening emergency situations. Stage 1, hypothermia begins when core temperature drops to 95 degrees. Patients experience uncontrollable shivering, loss of fine motor control, and impaired judgment. This is the golden window where simple intervention can prevent progression to more serious stages. Stage 2. Hypothermia occurs below 90 degrees core temperature. Shivering stops, consciousness becomes altered, and patients make increasingly poor decisions. Heart rhythm abnormalities begin, and the risk of cardiac arrest increases dramatically with continued cooling. Stage 3 hypothermia below 85 degrees core temperature results in unconsciousness, cardiac arrest, and apparent death. Patients in stage 3 hypothermia have been successfully resuscitated after hours of clinical death, leading to the medical saying, "No one is dead until they're warm and dead." From a treatment perspective, preventing progression from stage 1 to stage 2 is exponentially easier than treating advanced hypothermia. Emergency sleeping bags excel at stage 1 intervention, preventing the physiological cascade that leads to life-threatening complications. The medical principle is simple: maintain core temperature above 95 degrees, and patients retain normal brain function and survival decision-making ability. Allow core temperature to drop below this threshold, and patients lose the ability to help themselves effectively. Emergency sleeping bags work by addressing the root cause of heat loss rather than trying to generate new heat. Reflecting existing body heat back to the patient is more effective than trying to rewarm someone who's already hypothermic and has depleted energy reserves. In wilderness medical protocols, we prioritize interventions that work for minimally trained rescuers under difficult conditions. Emergency sleeping bags meet this criterion perfectly. They require no medical training and work regardless of rescuer experience level. The effectiveness data is overwhelming. Patients wrapped in emergency sleeping bags maintain stable core temperatures even in severe weather conditions, while patients with traditional camping gear often continue cooling despite rescue efforts. Wilderness medical training emphasizes that prevention is always preferable to treatment in remote areas. Emergency sleeping bags represent ideal prevention technology, simple enough for anyone to use, effective enough to prevent progression to serious hypothermia stages. The medical evidence is clear. Simple thermal protection prevents hypothermia more effectively than complex treatment after hypothermia develops. Emergency sleeping bags excel at prevention, which is exactly what wilderness medicine priorities. Understanding hypothermia from a medical perspective makes the effectiveness of emergency sleeping bags obvious. They interrupt the physiological processes that lead to life-threatening complications, keeping patients in the manageable stage 1 range where survival is likely.